Is it starting? Yes, we're in. Yeah. Hi, I am Miss Sloan, and this is a very small reviewing group, but we are mighty and powerful. And we are reviewing chapter 12, the cardiovascular system. Here's a little list of the items you want to be comfortable with. I will send this to you. Plus, I know I'll post it in Google Classroom with this video, so you can just go through it real quick and make sure I address anything that you're concerned about. But you will have more time. Do a little skim of it right now. Okay, we good? Did you get a chance to look through it? Skim it, skim it. All right. So, first thing we want to do is remember what homeostasis is, and that's your ability to respond to your environment. And it could be, we learned about this at the very beginning. Living things are organized, made of cells. They acquire material. Yes, remember this? Key life characteristics. And your external environment could change, and your internal environment could change. One of the ways we can respond to it is through feedback loops. What were the two feedback loops we've talked about so far? Do you remember? Positive and negative, right? Do you remember? Think about it in your mind before I show you the slide. What do you think of, how would you define positive feedback versus negative feedback? Tell the person, whoever you're closest to. What would be the difference between those two? They're very quiet. What would you say? One of them is more gets you more, and one of them is more gets you less. Okay, riddle me this. One of them is more gets you more, and one of them is more gets you less. Which is which? What is more gets you more? Positive feedback, yeah. And is positive feedback common or rare? Do you know? Rare, yeah. This is amping up the response. It would be like if I asked you, would you like a cookie? And you said yes, so I gave you a cookie, and then I made you eat 2 cookies, and then I made you eat 3 cookies, and I made you eat 4 cookies, right? More would get you more. Okay, there are only a few examples of that. One of them is childbirth. So pushing the contraction, when the uterus contracts and pushes the baby's head against the cervix, that stimulates a message back to your central nervous system and says, okay, let's contract more then. And this will keep going until you get that climactic event of a baby coming out, right? So negative feedback is more corrective. You have a set point, and if you're above it, you got to lower it. If you're below it, you got to raise it. And you could think of blood sugar and that you want it to be just right. So if your blood sugar is too low, then you're going to secrete the hormone glucagon, which is going to elevate your blood sugar, taking sugar out of storage. But if your blood sugar is too high, what are you going to secrete if your blood sugar is too high? Do you know? It starts with an I. Yeah, insulin, and that'll lower your blood sugar to keep it just right. And that is the majority of our feedback loops are negative feedbacks. There are just a few examples like giving birth or blood clot until you get that climactic event of a blood clot, or in the menstrual cycle until you've built up your uterine lining. There are a few examples of positive feedback, more in negative feedback that are corrective. And probably the one I think about on negative feedback, don't think negative like you just said something mean to me, but think of it as corrective. Think of it like cruise control on your car, right? If you're on the freeway here in California, the speed limit is what? Do you know? Aren't you driving? 65, right? 65 miles per hour. So if you set that in your car to be 65, if you go down a hill and you start picking up speed, right, it'll try to lower it to correct it back to 65. If you're going up a hill, it'll have to apply more gas to get you to go 65. So it's just corrective. Negative means I'm taking you away from that stimulus. Positive, I'm taking you towards that stimulus. Do you see the difference? More gets you more. I'm going in that direction. Negative, I'm going away from the stimulus. All right. And I gave you a little chart here to help you with that. All right. Next, we talked about the different blood vessels. So let's do our little song. We'll put all the parts together of our song. Here we go. Arteries go away from the heart. Veins go towards. arteries, arterioles, capillaries in the middle, venules, veins. Then we said heart, body, heart, lungs, heart, systemic, heart, pulmonary, heart. When we're going to go on systemic, what is our blood in our arteries? When we go away, it is oxygenated. We exchange the capillaries. We come back deoxygenated. When we're going on our pulmonary circuit, it goes away in an artery, deoxygenated. We exchange gases in our lungs and we come back oxygenated. And then we said atria collect and ventricles pump, right? So when we talk about the four chambers of the heart. So knowing that arteries go away from our heart, it makes sense that they're thick and they're muscular and they're elastic, because that's when your blood is going to be at its highest pressure, is any kind of artery. So when we think about arteries, what is the largest singular artery in our body? Aorta. And the aorta goes away. Remember, if we drew this, right, the aorta goes away from the left ventricle. Remember, the entire left side of the heart is the oxygenated part. Remember, I said to remember your circulation. Arteries go away, veins go towards, right? You need to keep your lefts and rights down. So whenever you see an image, right, it's always, if it's on the person, right, it's their left, right, and their right. And then I talked to you about anything associated with your lungs. What word are you going to use? Pulmonary. Anything associated with your heart, what word are you going to use? Do you remember? Coronary. Coronary. And then we talked about...
Could you say that again?
No.
My apologies.
Okay, thank you.
I couldn't hear what you said.
Okay, thank you. So remember we talked about the hepatic portal vein. Do you remember that? And that was the junction between the stomach and small intestines and your liver. Hepatic, anything hepatic is liver. Okay, just throwing those out there, just reminding you. But arteries, since they're under greater pressure, right, because they're going away from the heart, we've got our aorta, and then we have our left and right pulmonary arteries going to our lungs. Those are thick-walled, very elastic, so they can withstand the pressure and snap back to keep the blood flowing in that one direction, right? And you've got the force on the blood due to the heart. Whereas veins, then you are thinner-walled, right? You don't have that extreme force on the blood. And we talked about what keeps blood moving through our veins. What gets it to move at all? Are what? Well, that valves keep it, that's important. Valves keep it going in one direction. But what gets it to move are muscles. Remember, our muscles push against the thin vein walls and kind of smish it. And when it gets smished, when it gets compressed, that would be a better word. When it gets compressed, it can only move in one direction, and that is due to the valves. Okay? Capillaries is where all what? Exchange takes place. Why can that happen? Because it's only one cell thick all the way around, right? It might be a cell, and a cell, but diameter-wise, it's one cell thick, and that allows for that exchange. Okay? Let's see. When we say arteries go away from the heart, right, then little small arteries are called what? Arterioles, and then capillaries in the middle, then venules, and then veins. Yeah, exactly. Perfect. Okay, any questions about that? All right. So then when we talk about the chambers of the heart and the way blood flows through the heart, right, we have our superior and inferior vena cava. Those are our largest veins of all, right? And they drain into the, and this, if this were a person right here, it would be on their right side, right? So into the right atrium. If it came back from our systemic circuit, right, if it came back from that, we know it's going to be deoxygenated if it's coming back from our systemic circuit, yeah? Okay, so it's going to collect here in the right atrium. The right atrium is going to contract, and it's going to send it down into the right ventricle. Remember, atria collect, and it goes right down into the ventricles pump, right? So it's going to go down into the right ventricle. If we just came back from the body, we better head where next if we just came back from the body? Lungs. Yeah. So we're going to go from our right ventricle. We're going to go up and out to our left and right pulmonary artery, plainal arteries, arterioles, capillaries in the middle, out at the lungs. We're going to drop off what gas? CO2, what gas should we pick up there in the lungs? Oxygen, and come back in the left and right pulmonary veins, which are going to drain into the left atrium. Remember, left side is always oxygenated. Left and lungs, they both start with an L, yeah? So the left side is oxygenated. It's going to put it down into the left ventricle. When the left ventricle contracts, see how thick and muscular it is? It's going to send it up and out the aorta. And it's going to go to our systemic circuit. If some of that branches out and goes to our heart, then it's specifically our coronary circuit, right? What happens if we don't get oxygen? If one of our vessels is blocked in our heart, we could get a heart attack, right? And so we talked about you could be sending blood to your kidney, or sorry, yeah, kidneys would be renal, but I didn't have you memorize that. We said going to our stomach and small intestines. And sometimes we pick up food if we've been eating, we pick up nutrients there. So where do we need to shunt the blood to via the hepatic portal vein before we return it to our heart? Remember? The liver. Okay. The liver, if you come in hot, high in glucose, the liver will pull it out and store it. If it comes in low in nutrients, the liver will put some into it as long as it has some to put in there, right? To keep your blood sugar levels slightly elevated. Right. So then we're going to repeat the circuit all over again. We're going to come back eventually into our vena cavas. So what kind of things would I ask on the test? I would say like, what structure of the heart sends blood to the systemic circuit? Which of the chambers? And you would tell me the left ventricle. Or I'd say, who receives blood from the left and right pulmonary veins? And you would tell me the left and right pulmonary veins. You would tell me the left atrium. If I said, what was the name of the valve between the right atrium and the right ventricle? Right atrium, RAT would be tricuspid. What is the name of the AV valve between the left and right atrium? LAB, bicuspid, right? Another name for that is the mitral valve. And then between both right here, these are the same name. Those are semilunar valves right there, like little lunar, little, remember what I taught you? Okay, so those semilunar valves. And remember, when we hear our heart beat, we're hearing valve doors slamming. The first one that's going to slam is you have your atria contract, and then the ventricles are going to contract right after that. In systole, it'll slam these AV valves first. They get slammed shut, and that's to make sure it goes out the aorta or the left and right pulmonary arteries. But then when the ventricles relax, it starts to suck the blood back, and that's when the semilunar valves shut, in that order. Okay? And I have another slide for that too. Any questions about the heart you want me to go over? Okay, this next slide was an overview of what we have discussed, both the systemic and pulmonary circuits. And so I wanted you to see here that when you have the blood here in your right atrium, down into your right ventricle, goes up and out to your lungs, gets oxygenated, comes back to your left atrium, left ventricle, up and out your aorta, to your systemic circuit, and then comes back via your vena cava. So I just wanted you to have another picture of that. Are you good with that? Okay. And remember, is any of our blood ever blue? No. Okay. It's just a deep, dark purple. Okay. And then we talked about pulse and blood pressure. I'm pretty confident you know what your pulse is. It's the expansion on your fingertips, right? Due to the left ventricle when we take our pulse. Not a lot of us take our pulmonary pulse. We just take our systemic pulse, right? And so you have that expansion. Blood pressure is different. That's measuring the actual force that it's exerting. And so you have your systolic pressure when the ventricles are contracting over the smaller number, which is your diastolic, when it's relaxing. So 120 over 70, 120 would be the systolic, the 70 would be the diastolic. And I reviewed already about your sounds. So that beating that we hear, the first sound is the AV valve slamming, tricuspid and bicuspid when the ventricles contract. The second sound is when the ventricles relax. It's all about the ventricles, right? It's all about the ventricles. They're either contracting and you want the blood to go in one direction, so it slams the door shut from which they came. And then when they relax, then the semilunar valves get slammed shut. Okay, and then the conduction of the heart. Okay, so we talked about the pacemaker of the heart is this little nodal tissue called the SA node, okay, sinoatrial node, and it gets a message from what part of your brain? Where does it receive message from? Do you remember? It's what your day is today. It's in that golf movie. Your medulla oblongata, right? And isn't today, what is the day? The dress up day. Adam Sandler, isn't that in his Adam Sandler golf movie where he talks about the medulla oblongata? No? Am I just pulling something from some mystery? You need to Google this. I don't care. Okay, so the SA node, okay, is triggered by the medulla oblongata, but the SA node itself is what's called the pacemaker because it's telling your heart how fast to beat. Now, in your lab, when you exercised, did your heart rate go up when you exercised? Yeah, because you were consuming more oxygen and producing more what? Carbon dioxide, CO2. And it really is, you have little chemoreceptors in the arch of your aorta that take your pH, and your pH lowers when you have more CO2 in your blood. And that's what triggers it to beat more and harder so that you have more oxygen. Because your body infers if there's more CO2, you must need more oxygen. Yeah, if you're making more CO2. All right. And then that wave of depolarization across your atria, that's measured right here in this P wave right there. Okay. Then it hits your AV node, and your AV node sends it down the septum, the middle of your heart, and around these Purkinje fibers right here so that the ventricles contract. And that's measured right here in the QRS, which is obviously a much bigger than the atria contracting, right? Also, during this time, side note, is when the atria are resetting and repolarizing. Okay, and then T, that's when the ventricles are resetting and relaxing and getting ready for the next stimulus. So atria contract, ventricles relax, and so you can measure that. And what happens if it's a straight line? What? Dead. You're dead. And if it's jaggedy, then you're fibrillating and you need a defibrillator, right? To reset your heart. And basically, you put a shock across the heart that you hope it all contracts simultaneously, relaxes, and you hope your SA node will reboot and it'll reset again. Okay. And then what happens at the capillary? We know blood moves to the arteries due to the force in the blood due to the heart. At the capillaries is where all exchange takes place. So the capillary bed has a region that is called the arterial end of the capillary bed, closer to an arterial, and a venule end, closer to the vein. Okay, so on the arterial end, the blood pressure is the greatest of all, and then it declines as it moves through the capillary bed. The osmotic pressure is pretty constant through the capillary bed, and the osmotic pressure is saying come in, and the hydrostatic pressure is saying go out. Yeah. And so as the hydrostatic pressure decreases across the capillary bed relative to the osmotic pressure, which is constant, kind of starts to win out, and fluids start to get recovered. So fluids are forced out due to the blood pressure and drawn back in, waste and CO2 due to the osmotic pressure being greater to bring it back in. Are you okay with that? All right. And then what happens in a vein? We talked about it. What keeps the blood going? The muscles contracting, the blood from behind pushing on it. But those muscles contracting on those thin walls helps to keep it going. And then valves keep it from falling back down. They keep the blood going in one direction. What happens when the valves break? You get what? Varicose veins. Where do you have the most vessels of all? At the capillary level, right? Here you have one aorta. It takes up this much space. You have capillaries. Every cell in your body has a capillary near it. So that's where you have the greatest surface area. And that's where the blood moves what? The fastest or the slowest? Slowest. Is that a good thing? Yeah, because it allows for exchange. Then as those capillaries come together and form venules and veins, there's less friction because you don't have as many vessels, so it speeds up a little bit. However, the pressure goes from high blood pressure down to lower. Yeah, the actual force on that blood. All right, and then we talked about what is in blood. Okay, and the contents. So you have red blood cells, and their job is to carry what? Oxygen. And you have platelets. What is the job of a platelet? Yep, perfect. Clot your blood. And white blood cells are to fight infections. And all of these formed elements sit in what? What's the fluid part of blood called? Plasma. Good. And the plasma is mostly water. I bet we can remember, due to the little learning technique we had, everything that is dissolved in the plasma. Let's see if we can do it together, and then I'll show you the slide, right? The word we think about is a road trip, right? We have to stop for gases. So gases are dissolved here in the plasma. That's what I'm talking about. Gases, we might want to get some nutrients. We might want to get some healthy proteins, or maybe we want some chips. So we're going to think of salt. We better go pee. So we think of nitrogenous waste, right? It's not fecal material in blood, right? We know that. Okay. Nitrogenous waste. And then we just remember, because we're smart, we remember hormones and vitamins. Yes? Okay. So those are all the things that are, notice how I phrase that. Those are all the things then that are located in plasma. Remember, it's mostly water, but these things are dissolved in it. And this proteins that are large, those kind of things can't get pushed out, but things like water and salts and gases and nutrients and nitrogenous waste and hormones and vitamins, those can all get pushed out, right? And then you pick up those wastes. And then the last thing we talked about were those health issues, right? A stroke is brain death. Why is it dead? Because it doesn't have any oxygen. Now, you could have a stroke as a result of an aneurysm. You could have a stroke as a result of a blood clot, right? You're just not getting that oxygen. We talked about atherosclerosis, when you have that buildup in your arterial walls. And when you make the lumen of a blood vessel smaller, it's harder for the fluids to get through it. And then we talked about heart attacks themselves, which is basically a muscle cramp in your heart. It doesn't have enough oxygen. And then we pointed out that the symptoms of a heart attack are much different. Who gets it fast, hard, swift, and in their left arm with a lot of pain? Who gets that? Men. Slow, I'm tired symptoms is more like women. And they go undetected, right? Because that just sounds like I'm just tired, right? I'm fatigued, when really you are having some symptoms of a heart attack. Okay, and then that, oh, I guess I didn't do it. That was it. Any questions that you have? Okay, good job. Yay. I think there were additional objectives, were there not? Yeah, so don't forget to do your additional objectives. All right, that's it. 23 minutes of fun.